I'm a big fan of digital therapeutics. If they can bootstrap or get money on their own, it's better than to go to investor. They tell me they're gonna close their round in April. I'm like, maybe not. I'm more interested in having a solution to my problem than having my data protected. ChatGPT was a big turn. There will be a before and an after. I wouldn't worry too much about digital health startups because the money's here.
Hi everyone, today is a big day for myself and for our channel. Today I get the chance to interview the one and only Aline Noizet. Hi Aline.
Hi, nice to be here.
Yes, finally we meet and we get this interview done, so I'm really excited. For those few of people who do not know who you are in digital health, probably they just started their path in digital health. Can you tell us briefly who is Aline Noizet?
Sure. So I define myself as digital health connector. So that's what I do, and that's also the name that I put to my company. So basically, I connect the different actors of the digital health ecosystem. So I work for startups in the past, for pharma companies, for investors, and been in touch with regulators, all the different actors. So what I do, my focus is mainly on startups, so to help them to grow, to connect with the right actor in the ecosystem and to make like magic happen, to push those innovations to the market. I really believe that innovation coming from small companies, innovative companies, can have a real impact on the healthcare system. So that's my mission in life.
Very cool. What did you do before digital health?
So I was selling spare parts for trucks.
Oh, that's interesting.
It's very different. So I was in the UK. And I was spending my days helping men to fix their trucks and to sell them spare parts. It was very interesting. I had a great time. But then I wanted something a bit more girly. And then just by chance, randomly, I ended up in healthcare. I fell in love. And yeah, it has been like 12 years already. And I love it. Still love it.
Great. So 12 years in digital health. For these 12 years, are you happy? Are you satisfied with where digital health is right now?
Well, it's a slow industry, but if I look at where we are today and where we were when I started, I think we did we've gone a long way. So I remember a conference where I started in London. That's when Fitbit came out. And if you think about it today, it's like we've got really past Fitbit, different versions of Fitbit, different solutions. And at the time I was like, well, how can we collect data? How can we speak to the hospitals? And today it's like we have so many data, we don't really know what to do with them. It's more about quality data today. And in the hospitals, like many of them have an innovation department. So yeah, I think in that sense, we've gone a long way.
All right. What do you think are the main drivers for digital health innovation right now?
So it really helps people to access healthcare. Like you can see it from different point of view. From the patient point of view, I think it gives access to some people. It gives access to treatment to some patients that wouldn't have access otherwise. It helps them to manage their disease better with tools that you can have on you, And then when it comes to healthcare professionals, it gives them tools to diagnose a disease better, to support their patients better. And then if we think about prevention, you have more and more solutions that go where the patient is. So in Africa, for instance, you can go in the countryside, do some checks, like eye checks or cervical checks for women, where they are. And if there's an issue, you can send them to the closer hospital. So I think that's really revolutionizing. There's also in terms of education. So I was talking to my friend Rafael Grossman the other week. We were in Saudi together at a conference, and he was mentioning an example in Maine, where he lives, of a company that are using AR/VR to train nurses. And instead of the 3 years that it takes to become a RN, not registered nurse, with AR/VR, they're making it happen in 18 months. So that's also a big improvement, and where technology is really having a big impact.
For sure. Over these years, you've probably worked with lots of startups, you've heard about lots of startups. Can you think of some examples when you thought, okay, this startup is gonna be really good, and you think maybe not unicorn, but at least a really great company, but for some reason they failed. Can you think of some examples?
Yeah, I can think of some. So maybe not concrete name comes to mind, but those solutions were, I think they were lacking the support. Either they didn't find the investment to go forward, or the regulation was done in place. So I remember one startup here in Spain, they needed to do clinical validation to get some investment, but they would only get investment if they were getting their clinical validation done. So that was really, the fish that it's his tail. So yeah, those kind of issues where like investment is for sure a big issue, and many companies died because of that. I guess another issue is that companies think that they have a great product, and then they go to the market and they realize like the market fit is not here because they never validated their solution with the actual users.
Right. Well, let's discuss the opposite case when you thought, oh, this startup isn't going anywhere for sure, but eventually it actually became successful. Can you think of some?
Yeah, so here are a concrete example. So when I started in digital health, I was working for a company called Doctoralia, based here in Spain. And then a few years after, the company Doctolib started in France. And when I saw them coming on the market, I was very curious because the founding team, they were coming from the Fork, the company to book restaurants online. So I met one of the co-founders here in Barcelona, like very early days. I'm like, but like booking restaurant is not the same as healthcare. And at that time at Doctoralia, I was exploring the French market to test if doctors would be willing to use our platform. And my conclusion was that France was not ready because the way the system was with our different system that you just call operator and it books an appointment for you with four different doctors. So for me, it was not clear, but Doctolib it's a unicorn today. So I think they've done a great job in educating the healthcare professionals, just going there and really we talk a lot about open innovation, using their knowledge, their expertise in booking system to enter the healthcare ecosystem. And then they built on that. And yeah, today they are a very, very successful company.
Really interesting. Yeah. All right. That was like a short introduction to my next question. So it's kind of a game. I'm going to ask you to go through this scenario. So a startup founder comes to you and asks for some piece of advice because he has so many problems in his digital health startup and he's like really close to failure. And he wants to know which problems he should solve first and which are not that important at the moment. So we have 5 problems. It's lack of feedback from his potential users' patients, recruiting chief medical officer, raising a round of investments, refactoring some of the outdated software, and promoting or doing the marketing of the solution. So can you put them on the scale from 1 to 5, where 1 is the problem that needs to be solved in the first place?
Okay. So first one for me would be the lack of feedback from potential users. So maybe more than lack of feedback is validating the solution, even co-creating the solution. So it's very important. That's what we tell startups. Make sure you involve healthcare professionals or patients in the process early on.
Right.
So you can ensure that the market fit works after. So that's super important. And we still see many companies who failing because of that point. Next point, I would say maybe recruiting a chief medical officer. So I know that especially from the investment side, that's something important, like an investor, when he looks at the company, it looks at the team, and if there's a chief medical officer in the team. From my point of view, especially in early days, if the team is small and you have to choose, like you can't have all the profile from day one, I tell them at least to have healthcare professionals or chief medical officer or a psychologist if your solution is mental health, part of the board, advisory board. So that person is still present, should have an important role, but maybe she's not part of the actual core team. And then when you get more money and more bandwidth, then you can hire that person.
Okay.
And then I would say, maybe refactoring some of the outdated software. So to make sure that you always keep to date. So technology is going very fast. You need to stay on top of what's happening if you want to stay competitive on the market, and also to enhance your solution. So your solution can benefit from those technologies.
All right.
Next would be raising a round of investment. So I think I always advise startups, if they can bootstrap or get money on their own, it's better than to go to investor. Because when you have investors on board, then you're losing some shares, and then someone is also has a say in the decision that you're making. So you can either, like FFF, friends, family, and full, or what some companies are doing, they are doing some consulting on the side that brings them some revenues that they can use to just feed the company. And last one for me would be like promoting the solution. First, I want to make sure that I have a solution. I've spoken to the right people, to the potential customers, to the patients. And once I have something, I would worry more about the promotion of the solution.
Okay, very interesting. Thank you. All right. Let's talk a bit about Spain and Barcelona specifically. How would you describe the digital health ecosystem right now here?
It's a very dynamic and growing ecosystem. So we have two hubs, digital health hubs. So one Barcelona Health Hub that was created, I think 4 or 5 years ago. And then we have a new one that's launching this week.
Oh, really?
From part of Tech Barcelona. So we have two hubs. So it really shows that there's an interest here. And I think those physical hubs are really helping to bring the people together, to create the synergies between the different actors and to attract people from outside. You know, when an investor is coming to town, he can just go to those two sites and meet the different actors that are part of those ecosystems. So, and it's, you've seen it yourself. It's a nice city. It's sunny most of the time, like 20 degrees today in February. That's not bad.
It's very nice.
Easy to travel. So I think that's really, helping the city. And I think also something nice that we have here, it's like all the different hospitals, and most of them have innovation center. And you see like many things happening, and they are also like reputed hospitals. So it's a great attraction point for entrepreneurs who want to do things in healthcare.
That's awesome. Have you heard about other health hubs in different other countries that are developing that fast?
I think France is going very fast at the moment. They have support from the government. Government is putting a lot of money. The president is really encouraging startups. They just created a new hub called Paris Santé Campus. And I see that really those physical hubs are really helping to push things. Yeah.
Interesting. You actually kind of started answering my next question. Out of all European countries, where do you think digital health is the most developed right now? And what are the top 3?
So for me, first, I would say the Nordics, countries like Finland. I think since many years, we've seen how there are a lot of companies there, like startups, like developing innovative solutions. They have regulatory in place. So I remember maybe 4 or 5 years ago when we were preparing conferences and sessions on regulation, companies were already sharing that their insurance companies were reimbursing solutions, and we're so far from that in the rest of Europe. And you see also in the hospital some adoption there. So that would be first one for me. Second, I would say UK. I think UK is also doing a lot. I think the NHS as the center system, really supporting innovation with nice, having that regulation in place, reimbursing solution, prescribing solutions. And then the third one Well, I'm French, so and I mentioned it before. I think that France is really doing a lot. I'm really impressed by what they're doing. So the other day, the Ministry of France, I met with them, and they explained me the different initiatives that they are doing. I think not all of them we are aware of, like in the as general audience, but I think it's amazing. They're really supporting startups with clinical validation. They are working on implementing a DIGA-like certification system like in Germany. They're also helping healthcare professionals with training and helping them to adopt those digital solutions. And again, so having that big ecosystem in Paris, and there's also hubs in different parts of France. But I think for me the secret is that when the central government is pushing, like injecting some monies to help the companies, like it really makes a big difference.
Well, frankly speaking, I'm surprised you did not put Germany in those top 3, since they started all the reimbursement programs, like the first one in Europe. But they're probably in top 5, right? And Spain also would be in top 5 if we.
So Spain is a bit, I would say, is a bit behind. I think we're really missing regulation framework here. So the particularity of Spain is that you don't have really a central system like other countries. It works by region, and each region has its own healthcare system, its own software to manage the system. There's no communication between the different regions. And each region has public and private system in parallel, and there's no communication between the two. So I sadly experienced it recently. There's no communication. So it's, so there's some issue there. And in terms of regulation, so it's more like the different region are doing their own things. I think in Catalonia is one of the most advanced. Biocat is putting in place like a fast track program that will help the companies to enter the different hospitals or healthcare systems here in Catalonia. So I think that's great. That's a great project. And there's also another group that's trying to move things so that it can happen on a national level. So for all the different regions, DIGA-like, to help them design kind of a DIGA system to be implemented in all of Spain.
All right, very interesting. In one of the videos I've watched, you were talking about a single regulatory framework for the whole European Union. And I think this is a brilliant idea, since US market really needs a big competitor, because there are so many issues with that. All the startups are still aiming to the US market because of the size and money, and that would actually create that competitor. So can you elaborate a little bit on that, and when realistically can that possibly happen?
So I'm not sure that that Europe will become a competitor with that like unified or European level of certification. So when I talked about that, it's in reference to the DIGA that we just mentioned in Germany. So that certification process for apps. So the issue is that Germany has its own DIGA, and it's only valid in Germany. Belgium has the mHealth program, valid in Belgium. Catalonia is working on its own. France is working on its own, but right now it's like there's no interoperability between those different systems. So when we're talking about that super DIGA that Pierre-Laurent mentioned at a conference a few years ago, it's to have that harmonization between the different systems. And someone that received DIGA in Germany can go to France and that certification to be recognized in France. But each healthcare system in Europe is different. And when you come to Europe, you will still need to enter each system. So yes, it will be made easier because of the regulation if it's recognized by other countries, but still you will still need to understand the healthcare system to enter that market properly. So honestly, I'm not sure that we'll ever become a competitor to the US. And then to your question, when do I think this will happen? I think it will take a long time.
10
years. I'd say 10 years. Yeah, maybe a bit less.
I see. Okay. So you kind of covered some of the problems of the industry before, and I have a next kind of game for you. Could you please scale from 1 to 5 the problems of the industry in general, where 1 is the highest priority, like needs to be solved like as soon as possible? So we have interoperability, integration of digital solution into hospital medical systems, regulations, the high cost of healthcare, and security of patient data.
Okay. Well, first I will say regulation, because I feel it's really a barrier. Mm-hmm. Like, to give you an example, here in Spain, a few years ago, telemedicine was not recognized as an option to see patients. Mm-hmm. It was even seen as unethical for healthcare professionals to do a video consultation without seeing a patient, or prescribing without seeing a patient. So many healthcare professionals were not doing it. That's why I feel that regulation really helps to make things happening, especially in digital health. Mm-hmm. So that would be the first one. I think when there's regulation in place, it helps. Then the second one for me would be like a big piece, integration of digital solution in hospitals, medical system. So for hospital, when you approach a hospital to try to sell your solution, mm-hmm. it's important to show them how your solution will integrate into the system. What does it mean for the healthcare professionals? What will they need to do? Is it going to be extra work for them? Hopefully not, but you really need to convey that to them, to show them that it's going to be really like seamless integration, and it's going to make the day-to-day easier. But yeah, that integration is very important if you want adoption from the healthcare professional side.
Okay.
Then I would say interoperability. I think we've gone a long way with that. Mm-hmm. I remember when I started 12 years ago, we wanted to integrate Doctoralia with different solutions, and we had each system was in different coding system. But today, I think most of them are using HL7. So I feel this is easier, but still it can be a barrier. Next one, I would say security of patient data. So on that point, I think it's important, to protect the patient data. In Europe, we have a GDPR. In the US, there's HIPAA. It's important to follow this. But personally, I'm more interested in having a solution to my problem than having my data protected. Like, I remember a few years ago meeting a girl who had like a rare disease. She was like, but take my data and make some investigation on it instead of having everything siloed, because she realized going to a doctor mm-hmm. that there was many girls who look like her, like blonde girl, like similar profile, and she had a cancer, and she said, well, maybe there's something genetic or something to do with biology. So if you can analyze those data and cross those data, then it gives answer. So I'm more of that. I'm like, yeah, take my data and analyze them. And then the last one, the high cost of healthcare. Maybe it's not so much the case in Europe, since we are used to everything being covered by the system. Mm-hmm. So me coming from France, it was interesting because in France, like, everything is free. You don't pay for anything. You go to the dentist, you never pay or hardly ever pay. And then you come to Spain, and you have to pay something every time you go to the dentist. And then you realize actually the value of the cost of things. Mm-hmm. And I think that's important. But I think in France recently, they started introducing the cost of care on the different papers, like when you go to the pharmacy. Mm-hmm. And I think that's good. I think we should really convey that to people, because in Europe, people are really too used to everything being free, or you don't realize like the value of things. And maybe another note on the idea of cost. One of the issue in healthcare industry is like, who is paying? Mm-hmm. So when you want to enter a hospital, it's like, yeah, but who will pay for it? Like, is it going to be reimbursed by the insurance, by the healthcare system? Is it going to be paid by the patient? So that's also another thing to take into consideration.
But lots of startups, when they come to investors, they say, oh, we're going to reduce costs because of the solution, stuff like that. But really, in general, I don't see any cost reduction thanks to technology in healthcare. Do you agree with that?
Oh, no, I don't. I think there is a lot of cost reduction, and because you can really save time. If you think about AI, artificial intelligence algorithm that can detect a tumor, like before you can even see it with your eyes, like treating someone for a tumor at early days versus treating someone for a tumor like stage 3 or 4, like the cost associated to that is like, there's a huge difference. No, I really do believe, like, if you think also about prevention, like we see a lot of technological solution used for prevention, it's the same, like those solutions will help those patients to be sick later or not to be sick.
Right.
And that's a big cost reduction for the systems. And for the hospitals, the same solution that will help like streamline the processes or organize the different tools inside the hospital to find something easier. So no, I really believe that technology can cut cost. But for a startup, like if you have a solution, technological solution, and you're saying that your solution is reducing costs, like really make the economics and show me that it's the case, like really do some numbers. That's very important for an investor.
Actually, to your point about preventive startups, there are not too many yet because it's not really, for investors, it's not really good startup to invest in money because it's really hard to prove that your company, your solution actually is preventing someone from getting sick. So I really hope that preventive health startups are going to appear more and more on the market and investments are going to actually look into it more.
But I think that we see more and more. Like it's really coming, and also because we have those years of feedback, and now we can prove that it actually does save cost. So investors are more willing to invest in those solutions. But again, health economics are very important to convince an investor. They love numbers.
All right. Let's talk a bit about investment. So the pandemic gave a huge boost to all the investment and the size of the rounds of investment. But 2022, we saw a big drop in that. And what were expectations for 2023 in terms of investment?
So first, I will tell you that we saw a drop in big rounds, not in smaller rounds. So I'm more active with like pre-seed, seed, Series A startups, and they were not really affected. And I've been talking to many investors across Europe, pre-seed, seed investors, and they all said the same, like business as usual. They didn't really change their investment thesis. For them, it's the same. So maybe those that were most affected were the bigger rounds like BC, maybe more in the US than in Europe. And then if a company is good, if the team is strong, if there's a solid solution, like they will still find the money. So that's what we're saying. Maybe years like 2022, there are years where you can see actually the best companies are still gonna survive and find the money.
I would probably not agree with that statement. I'm not sure that all the best companies actually survive nowadays because still there's lots of depends on your networking and your connections. And I know so many companies with such amazing solutions and they just cannot find investment because I don't know, somebody is a better friend with an investor than this founder is, and they don't get the money because of their personal relationship, not because their solution isn't great. So I'm not sure that all the great company, all the best ones, are actually getting the money in it finally.
Well, but I don't know. I guess if you talk about pre-seed, early stages, but when you talk about later stage, I think what matters is really the outcomes, right. the numbers, right. Not so much if you're a friend with an investor.
Yes, of course. When you're trying to raise that around B or C, you have so many evidence that you just go show the numbers that your solution works. Yeah. That's definitely not a problem. But for pre-seed and seed, that's still an issue, I think.
But yeah, to your point, I think maybe you remember that company in Germany a few years ago that raised 1 million euros for launching like pink gloves on the market for ladies to take off their tampons. And this is actually, we don't need gloves to take off tampons as women. And you have other solutions that are actually useful but didn't find the money. So yeah, I agree with your point that it does happen. Yeah, it's not always easy. But yeah, and you're asking me what do I expect for 2023? Maybe from the startup point of view, it will take the processes, may take a bit longer. The process may take a bit longer for them to get the round. So when I talk to companies in January and they tell me they're going to close their round in April, I'm like, maybe not. I think it takes longer than the startup expect. But what we have to keep in mind is that 2021, 2022, there was a lot of funds that got created to invest in digital health, also general funds that added new money to the funds to invest in digital health. So there's a lot of money, and that money needs to be spent. So I wouldn't worry too much about digital health startups because the money's here. I think they just need to be a bit more patient. It's possible that the expectations from the investors are going to be a bit different, but that's what I always tell them. Do your homework. Go on the website of those companies, see what they are looking for, get to know them, what they expect. And but I don't think it will be a bad year.
I think this is really important for lots of startups that are watching us to understand that this is definitely not the time to give up.
Exactly.
Okay.
But just to be patient.
Right. Of course. So another one for you, I'd like to ask you to, as a digital health connector or consultant, to put on a scale from 1 to 7 these types of startups that would likely raise a round of investment. So 1 would be most likely to raise funds, and 7 would be the least, probably won't raise fund at all. So we have primary diagnosing chatbot, VR educational app for surgeons, decentralized clinical trials platform, a mental health app with the aim to solve panic attacks, crypto wellness app where users can earn tokens for participating, for practicing good habits, healthy food, sports, and stuff like that. Telehealth platform with integration with multiple devices. So basically it's telehealth and remote patient monitoring. And digital therapeutics platform for a specific chronic disease. Which one you think would likely raise funds?
Is it for 2023?
Yes.
Okay. So number 1, I would say digital therapeutics platform for a specific chronic disease. So I'm a big fan of digital therapeutics. I think it really brings an answer to the healthcare systems. It can really have an impact. So that would be my number 1.
All right.
Number 2, I would say telehealth platform with integration with multiple medical devices. So just because of the second part of the sentence, I think there's big competition in telehealth, but you need to go one step further. So that would be the part. Third, I would say decentralized clinical trials platform, although I'm seeing a lot of competition and I still have some doubts about the future of decentralized clinical trials, but so will be my number 3.
Right.
And then I would say VR educational app for surgeons. So education is super important and we see this more and more. Then I would say crypto wellness app. So with the NFTs and the Web3, I think it's still a bit early, but we're starting to see that. And something that I like about that is like, you can actually earn money for selling or for sharing your data. And I think that's a business model that we're going to see more and more. But maybe it's still a bit early. Then I would say primary diagnosis chatbot. So the reason why I'm putting it so late in my ranking, it's because of ChatGPT. I think ChatGPT is kind of bringing some competition to that phase. From my point of view, it maybe lost a bit of. It's easy to do it with ChatGPT. And the last one would be mental health app with the aim to solve panic attack.
There are too many.
I'm not too sure about the panic attack one, but mental health, it's like a very crowded market. So if you're in that space, you really need to explain your differential value. And if you can choose like a niche inside mental health, just here I'm not super convinced about panic attack. Yeah.
Okay. Perfect. Thank you. So I know that you're helping startups like creating, updating pitch decks. What do you think is the most important thing in the pitch deck that startups should prepare?
The team. Like when you're early stage startup, the team matters a lot. So make sure that, you have a complementary team. Diversity is also very important in the team. Like when we see decks with like 18 white male, maybe that's not the best sign. So really try to have a diverse team. Something also important is to really define well the unmet needs. So what's the problem? How you can solve the problem? What's special about you, and why should I work with you and not with someone else? And something that companies often forget is how much are you looking for, and what are you going to use that money for?
All right. I asked you about the expectations for investment in 2023. What are your general expectations for digital health in this year?
I think that ChatGPT was a big turn. There will be a before and an after, and we'll use it for different things. I think for experience, like I have a friend who is using it to help patients to understand their health data in the US, their health records, etc. So I think we will see more applications around that. Maybe my keyword for 2023 would be experience. So to focus even more on the experience, like what we want is experience as consumer, as patients. And I feel those technologies are really helping. Like more and more, they are offering that experience that we are looking for. And I think I'm hoping, more consolidation in terms of regulation, as we mentioned. So hopefully France will launch their own certification system this year. And we can see that other countries are following the path, and that's very good news.
Cool. Finally, at the very end, I ask my guests to give some kind of recommendations or piece of advice to startup founders in digital health. What would you recommend in order to become successful?
Make sure you choose a real unmet need. So identify that unmet need very well. Be very clear on the solution that you can provide, the differential value for you.
Very great advice. Thank you very much, Aline. That was a great conversation.
Thanks. It was my pleasure.
Thank you. Bye-bye.